The newly released results of a landmark clinical trial by the National Institutes of Health could bring about a fundamental change in the way doctors treat high blood pressure. The NIH says 1 in 3 Americans have hypertension, and it is one of the leading causes of heart disease and stroke. It's also known as the silent killer, and its huge toll on business and economic productivity is just as stealthy, says Dr. Aravind Sekhar, an interventional cardiologist at the new GUAM Regional Medical City.
The estimate is that it's around close to almost $50 billion for just the mortality, and when you take also the morbidity associated with it, in the sense that people not being able to get back to work and things like that, it's almost 90 billion plus. So it is a huge cost, and it's not surprising because cardiovascular diseases have been among the highest causes of death and morbidity in the U.S.
Sekhar says the impact of the study results could be substantial. It could drastically reduce costs, but more importantly, save lives.
20 years down the line, if you are able to reduce the number of deaths and the number of patients who are having serious heart disease, that would be a major effect on, for example, the healthcare costs in the U.S. are the highest in compared to any other country in the world. And so this could have, for example, a big effect on the economy over the next 10 to 20 years if we are able to decrease the costs due to cardiovascular disease.
The NIH study is known as SPRINT, or the Systolic Pressure Intervention Trial. Systolic refers to the top number in your blood pressure reading when your heart contracts and pushes blood out through the arteries. Basically, the study compared the benefits of maintaining systolic pressure at the 140 range versus the 120 range. Sekhar says doctors have long been divided over which range to apply, especially for older patients over 50. The NIH believes the results are so significant it cut the study short so the findings could be released as soon as possible.
To their surprise, the results were so dramatic that they actually are able to see the results already. So a couple of years earlier than they expected, there is a dramatic difference, and it clearly shows that the blood pressure goal of 120, the patients who had that blood pressure goal did much better than those with a high blood pressure goal of 140. This was a dramatic difference. They did see almost a 25% decrease in just mortality, and they also saw almost a 1/3 difference when you include the morbidity caused by heart attacks, strokes, and heart failure admissions.
This might be especially significant for GUAM patients. Dr. Sekhar says we may have a higher per capita incidence of high blood pressure due in part to our local food choices.
One of the major causes of elevated blood pressure is also very high amounts of salt in the diet, and so those kind of things, depending on the kinds of foods that people eat, it can increase. For example, spam is very common in GUAM, and spam usually contains a large amount of salt and as well as fat, and both of these increase the risk for cardiovascular diseases.
Sekhar says now that the clinical trial has answered the key question of what the target blood pressure should be, and the NIH took the bold move of ending the trial early, doctors here will soon be able to start studying up on the new guidance.
This is going to most likely change the current guidelines, meaning that so the doctors who are now treating blood pressure, who are have a patient whose blood pressure is say 130, who thought that maybe by the current guidelines you wouldn't need to do anything more when that patient comes in to visit you, but with the newer guidelines it will probably address that we should try to add probably additional interventions.
He says what's also significant from the study is that most of the drugs used were already available as generics. That means less costs associated with the treatment.
And a lot of generics are, for example, available at in these large pharmacies for for $4 for a prescription. So we are not talking about very expensive interventions. These are actually the drugs that have been around for a long time, and so in one sense we have what we need to decrease, say, death by 1/3 and death by 1/4, and the morbidity by 1/3.
Ironically for Dr. Sekhar, this could mean he will have less patients to treat, which he says is just fine with him.
As a cardiologist, the patients I see, it's sort of like I'm like a fireman trying to put out the fire. But what this study is doing is trying to prevent the fire in the first place, which is what we want.
For KUAM's Business Matters, I'm Nestor Licanto.